I'm Alex Michaels. I am a general surgeon and minimally invasive surgeon here at Duke Health. I'm primarily taking care of patients who have problems that are going on in their belly, such as having a hiatal hernia, reflux, issues with their gallbladder, issues with their small intestines, any issues with their stomach, some difficulty swallowing. The other thing that I do minimally invasively, and that goes along with that, is a lot of hernia repair, so abdominal wall hernias. These include hernias in the groin, such as the inguinal hernias that very commonly people have, but also kind of more complex hernias when someone needs abdominal reconstruction after they develop a hernia from their previous abdominal surgeries. I like to read a fair bit about each patient before they come in, so I look through all the records, their imaging, have a good idea of what we're going to talk about before we go in, but then I just start with a very open-ended question of, like, what brought you in today? And just have a conversation. It's often surprising. You go in with, usually you know what someone's there for, what they're going to say, but sometimes it's completely different. So I like to kind of leave it with a big open-ended question and just listen to what the patient has to say and taking it from there. Something that I take a lot of time to do is explaining things to patients. I want to make sure that they understand using non-medical language, what is going on, what the different treatment options are, and discuss with them what option I think would be best for them. When someone comes in with a large hernia and you do a 3, 4, 5 hour operation and everything goes well, they go home a couple days later, seeing them back 3 or 4 weeks later in the clinic and seeing how well they're doing, how happy they are, that's kind of what I really enjoy, of seeing the big difference between preoperatively and postoperatively, those kind of that usually month-long period, and seeing kind of how well people are doing.